All right, so just allow me to say thank you all once again for joining us today on this webinar, where we'll be talking about how the church and faith communities have been responding to COVID-19 and what lessons we have learned during the pandemic. My name is Ruth Kayima, and I work with World Renew. I will be moderating the session today. And if you're new to Christian Connections in International Health, or CCIH, I want to give you a very warm welcome for joining us today. And just to tell you a little bit about it, it's that it's an international network with approximately 115 Christian organizations that are part of this and 15 secular partners. And we also do have a few hundred individual members. And CCIH's mission is to promote health and wholeness from a Christian perspective and provide opportunities for capacity building, networking, and the sharing of experiences, practices, and as well as carrying out advocacy. So for today's webinar, we will be having two speakers. I know the announcement and the webinar flyer that you saw said 3, but we do give apologies on behalf of one of our speakers who was not able to make it. And that is Dr. Annelise Wilder-Smith, who was called into another urgent meeting at the last minute. So we'll briefly hear from each of our speakers. They will each speak for about 10 minutes, and then we will open up the session for questions. So as we go, please feel free to put your questions in the chat box, and then we'll answer as many as possible at the end. And now that we don't have one speaker, I guess that gives us about 10 extra minutes to get more into the discussion. This webinar will be recorded, and if you need to access it later or share it with any of your networks, it will be posted on the CCIH YouTube channel and also on the CCIH website at ccih.org, and the resources folder, infectious diseases, and into COVID-19. You will also get an email that you used from the email you get used to register. You'll get a link of the recording once it is posted. So just by way of introduction, my name is Ruth Kayima, and I work at World Renew as the Health and Gender Coordinator for East Africa. And I provide technical support for our teams and partners on the ground in the design and implementation of community-based programs. I hold a degree in nutrition and dietetics from the University of Nairobi and my master's in public health from Mqhayi in Uganda. I am also the co-chair of the CCIH Community-Based Prevention and Care Working Group, together with Dr. Henry Perry. And I welcome you all to this webinar today. So our first speaker, who I'd like to invite, is Nyandwi, who is the country director for World Relief in the DRC. He holds an MA degree in rural sociology and community development from the University of Nairobi. He has over 18 years of senior leadership experience in international NGOs, Christian-based, and he has more than 28 years of experience in humanitarian response and transformational development in Kenya, Burundi, Rwanda, Mauritius, and the DRC. And he has mainly been overseeing the design and implementation of health and nutrition projects, agriculture, food security, child protection, gender, economic development, education, peace building, WASH, and many other programs. In his presentation, he will be talking about Ebola preparedness for Ebola and how it has contributed to early intervention and prevention against COVID-19. Together with the best practices and recommendations for moving forward. You are welcome, Jean.
Thank you, Ruth, and welcome everyone to my presentation. I'm going to talk about church and COVID response in DR Congo, or the Democratic Republic of Congo. We focus mainly on Kako, Kiwanja, Mugunga, and Ituri church permanent zones. Next slide. Maybe before I go on with my presentation, I think it would be good to give you a bit of background of World Relief, where we work, especially where we work. We work in North Kivu, Ituri, and Tanganyika provinces. Mainly we use a model or an approach known as Church Empowerment Zone, where we mobilize and empower churches through training and integrated programming. Of course, as Ruth has said, our response to COVID-19 is built or based on our experience with Ebola response, because as you know, when the COVID-19 pandemic was declared, we were still responding to Ebola in North Kivu and Ituri provinces, where we focused on WASH interventions, education, and messaging through local churches. Next. Yeah, in terms of COVID-19 response, well, initially when it was announced, people were very ignorant about it, and they believed or thought that this was a disease for Western and Asian countries, or for major cities like Kinshasa or Goma, in the case of DRC, or maybe for rich people who travel a lot outside DRC. So based on this ignorance, we decided as an organization to train church leaders and volunteers on COVID-19, the symptoms and signs, and also preventive measures. We also used Bible studies, working with church leaders. It makes a lot of sense to approach it from the biblical point of view as well. And so after training the church leaders and volunteers, they went ahead and organized awareness campaigns. This involved mainly, educating people and sensitizing people in their respective villages and churches, about COVID-19, especially its existence, and how, you can know that, somebody is suffering from COVID-19 and how to prevent it. This is an ongoing response. We started, I think, around April last year. So it's still going on. The volunteers and church leaders are still responding to this. And we also use community radios or radio stations to spread the message. As you can see on the first photo, the first photo shows one of our team members, training church leaders and volunteers. And then the next two photos show now how the church leaders and volunteers are putting into practice what we train them on, sensitizing people on especially focusing on prevention. You can see a bucket there because we mainly focus on prevention more than cure, and especially using clean water and soap to wash their hands. Next. As the church, response to COVID-19, we tried our best to build their capacity by, distributing a few things that, that could be helpful in their ministry. But before we did that, or rather before I go to that, that's the next slide actually. This slide shows us the number of people we've been able to train, church leaders and volunteers, 598 church leaders and volunteers who are committed and engaged to responding to COVID-19. And the number of churches involved are 239. And the beneficiaries that we've been able to reach are more than 100,000 people. Next slide. Yes, these are the things that I was talking about, some of the things that we've been able to distribute to different churches and also health centers to help them fight against COVID-19, 50 thermoflash and 500 units of hand sanitizers, 250 pieces of liquid soap, more than 1,150 bar soaps, 9,000 face masks. These are the things that we distributed to them so that they, to equip them to be able to fight effectively to COVID-19. Next. Now, as different churches and volunteers continue implementing the response to COVID-19, we've been able to identify a few best practices. There are so many, but these are just a few of them that I wanted to share with you. And building on the lessons learned from our response to Ebola last year in North Kivu and Ituri provinces, we've realized that focusing on preventive measures is much better than focusing on the cure, especially because we don't have well-equipped health centers. But even those who have them, prevention is always much better than the cure. And we've realized that hand washing with clean water and soap is very effective. And churches have also, based on this good practice of regularly washing hands with clean water and soap, they've been able to continue church services and ceremonies. They were able also to come up with, some good strategies. They reduced the numbers of attendees and increased the number of church services rather than just closing their churches and just stay at home. And, in the African context and DRC in particular, people like greeting each other, shaking hands and hugging each other as a sign of love and, caring for each other. But they've been able to stop this and, they greet each other without shaking hands. And dispelling harmful beliefs also is another good practice, in the fight, against COVID-19. Some of the harmful beliefs, I'm going to share them in the next slide. They also kept their faith in God, and they've been able to use outreach groups to cascade COVID-19 awareness and prevention, at the household level. Next slide. Now, some of the harmful beliefs I was talking about is that, some people still don't believe that COVID-19 exists. Well, this is basically built on the conspiracy theories and mistrust that has been developed over the years. Another harmful belief is that COVID is for specific groups of people, and especially from people from Western and Asian countries. There's also confusion about science and faith. The major question is, should we rely on both God and science, or either rely solely on God or science for protection and cure? So that's a huge question that people are asking themselves, and people seem not to have really clear answers. Access to controversial theories through social media, who to believe and who not to believe. And that is another big question that needs to be addressed. Another challenge is that many churches rely on external aid, which delays response whenever there is a pandemic or epidemics in specific zones. Next. Now, let me finish by sharing a few recommendations based on our experience, what we've been observing as, you know, together with churches as, you know, as we respond to COVID-19. Churches should have the capacity in terms of skills and finances. We've realized that, you know, depending on, you know, outside aid delays response. Invest in building capacity of church leaders. Why? Because church members obey and follow their church leaders faithfully, and they believe in what they tell them. The third recommendation is that church volunteers should be used because they are really very, very effective. They know very well their communities, and you know, by using the outreach group model, you know, it can be really very, very helpful because this is a model that, you know, whereby volunteers go, you know, door to door, you know, spreading the message about COVID-19 or any other epidemic or pandemic. Where we need to learn more from independent research to establish the truth about what leads some people to mistrust science, pandemics, epidemics, especially vaccines. Why is that so? Because it's very repetitive. It was the same for Ebola. Now it is the same for COVID-19. So there should be really good research so that we may know the source of this issue and be able to address it effectively. Thank you for listening.
Oh, thank you so much for that presentation. I'd now like to give the opportunity to Dr. Monde Bambo, who is a senior manager in Gauteng, South Africa, in the Department of the Health Hospital Service Directorate. She's responsible for supporting central, tertiary, and specialized services in Gauteng province and assists the Acting Deputy Director General with overseeing hospital services in mental health, quality assurance, oral and dental health services. Dr. Monde has a BSc and an MBCHB, both from the former University of Limpopo, now Medusa, and a postgraduate diploma in health management from the University of Cape Town. She's a subject matter expert in health and wellness from the Methodist Church of Southern Africa, Women's Manyano Wellness Committee. She will be speaking on the church response to women's wellness and mental health during COVID-19. You're welcome, Dr. Monde.
Good afternoon and good day. Thank you very much for the opportunity to present. The focus of the presentation is mainly going to be on the period during the hard lockdown. And the reason why I'm focusing mainly, I'm looking at the undervalued or underrated or understudied impact of what happened during lockdown, particularly to women's health and wellness, especially how is it that the churches then had to adapt to the new normal when the churches were locked down and were not able to access the members of the community. Next slide, please. As an introduction then, the Women's Manyano is a Methodist women's prayer and service union that stands for holiness of life, purity of speech, temperance, and service to the glory of God. And the Manyano stands for the extension of God's kingdom. And the organizations in our church are grouped, Women's Manyano and the men's organizations and the youth units, which are part of the mission of the society and should therefore be regarded as mission groups. Unfortunately then, during the COVID-19 period, this extension of God's kingdom was severely affected as we could no longer be able to access our members. May I have the next slide, please? Now, what was the impact of COVID-19 to all of us, especially when we started getting signs like, sorry, we are closed, please come again. And wherever we went, we found that please wear a mask before entering. COVID-19 devastation has seen 3 million people lose their incomes. A household survey published in July 2020 revealed that there was almost immediate net loss of 3 million jobs between February and April 2020. Women accounted for 2 million of the people who lost their livelihoods as the economy was shut down. Next slide, please. Now, what was the major impact of this devastation was that the prevalence of and burden of mental is usually higher amongst women in particular, more than it is amongst males. Women are most significantly likely to experience and suffer from mental conditions like depressive disorders and most anxiety disorders, which are correlated with poverty, gender-based violence, and HIV, and the greatest victims of these are women. Now, with the COVID-19 pandemic, we found it affecting women more profoundly than men, because the majority of the women that were doing the low socioeconomic facilities, such as being domestic workers, the ones that were owning hair salons, which were the ones that were affected the most when there was a hard lockdown, because now people were no longer able to go to work. Those that could only go to work were those that could access their work remotely. And then we found that the ones that were also affected and they were at most risk of being infected by the COVID virus were women, as they are the ones that are frontline workers, the majority of them being nurses and some being doctors. This then sharply raised and revealed the gender disparity amongst men and women. And then when we look at the definition of health as a whole from WHO, it indicates that health is a state of complete physical, mental, and social well-being. And with the COVID-19, we found that not only did it impact on the physical, but it also impacted on the mental as well as social well-being, as people could no longer access their sources of income. And then mental health is then defined as an essential element of health and is crucial to the overall well-being of individuals and society. And COVID-19, unfortunately, had a severe impact on this. Next slide, please. So what we then realized as well was that many countries also reported an increase in domestic violence cases after COVID-19 outbreak. Women were asking for more support with the domestic burden can trigger domestic violence against women. What we also found out during lockdown is that home, unfortunately, were not always a safe place. The exacerbation of gender-based violence may not only receive the attention that it needed, because now women, unfortunately, were locked down with their spouses that were against them, and they could not readily access help. Next slides, please. Now, this was the challenge, therefore, that we were given as by our presiding bishop, noting that now as the churches, we were closed, we had now to review and re-evaluate how do we then access our congregants and how do we reach out, because like I indicated earlier, that as Women's Manyano, we are a mission group, and mostly how we went about it, we went through visits, home visits, we went through campaigns. Now all of that was not able to be accessed anymore. So it's therefore a challenge that we need to reimagine. She called for us to be humble enough to admit that now then in our processes, structures, methods, and traditions and practices really needed rethinking and review. It was easy for us as a church to slip into the entrapments and exhaustion of our empire and still wanted to do things as normal. Then we needed then to be deeply rooted in God's love. How do we then extend our kindness and generosity and being empathetic to our congregants when we could not access them? Next slide, please. We then came up with mechanisms of reaching out to our congregation using the new normal, because now churches were closed. We then went on to host webinars are looking and targeting specifically at the well-being and matters that were very close to our women. So we had, I just only put in 3 of the examples, but we had ongoing webinars, not only just webinars, we also starting having virtual services that were now conducted. We also saw for the first time, because the closure was around Good Friday in South Africa, where our presiding bishop and the general secretary actually went now into our national television and conducted our Easter services through the media, because we realized that as much as we could not reach them physically, but we had to use what was available to us. So we had What a Girls Want, which was focusing on empowering a girl child, to an extent that one of our young girls, Rianketsi Manaka, ended up being a delegate to one of the international conferences. And one of the plights that we picked up the most, as I've indicated in the presentation already, was that mental health was a major issue that has yet to also come out. And we have not yet even scratched the surface. And when we also focused on missioning and witnessing during the time of COVID, and then What then this webinar focused on, as you could have seen, that we had invited our Honorable MEC, who's responsible for coordinating all the faith-based organization in the country. And then we identified how do we partner with government to also ensure that we then reach out to our communities, because our roles and responsibility as a church, we're no longer able to reach out through the food parcels. So we then partnered with government to make sure that we then open a mechanism of then supporting them in terms of giving the database of the structures that we used to be able to assist them. And we also picked up the fact that church also is an employer. So we invited a speaker who is a specialist in wellness, employee wellness, and then identifying how is it possible then for the church to be able to reach out and support their ministers, because they were severely impacted by the closure, because since churches were closed, ministers were also highly impacted, and they were also front lines. They were the ones now that were reaching out to the families, but unfortunately could not reach out to them due to restrictions. So the only way that they used to be able to reach out to them was through the burials. And even then they were highly restricted. So we then also invited a psychologist who then gave us a mechanism and toolkits to be able to reach out to our women and to our ministers and provide support. So through these webinars, we made sure that we still as a church were able to educate and be able to reach out to our communities. And we also engaged on gender-based violences and partnered with the community members and the police to reach out and also share information on how to get help during the COVID-19 pandemic. May I have the next slide, please? So our recommendations moving forward, that should we find ourselves in a similar position, we really need to reimagine our missional and landscape and how we participate in the future, transforming our culture of resistance to change, because we did get some challenges, especially when we had to come up with mechanisms, for example, of how to go about giving Holy Communion during lockdown, where the ethos and disciplines of the church were quoted, but then we could not reach out. So we had to reevaluate our doctrines in the church. We need also to own up the movement as a church. There's a movement that is called Thursdays in Black, which is an international movement that is fighting gender-based violence. So we felt that as a church, we should not just dress in black without highlighting the challenges that women are facing. So we need to take it a step further and be able to even reach out to the survivors of gender-based violence and address our abuse within our own circles, because we felt that even as a church, we have got some mechanisms or forms of abuse that are taking place that we've been silent about. So this gave us an opportunity now to go and address. So we needed to educate, empower, and start speaking truth to power. When churches were closed, we saw our Council of Churches and our ministers going sharply and addressing the challenge of having churches closed, because not only our churches are not just for preaching, but we are missionally that go out there to reach out to our communities. We could no longer be able to reach out to the poor because of the closure. So we had then to go and challenge some of the regulations that were put in place that were very restrictive, challenge cultural norms and how we raise our children, because we started shaping and then now being faced with lockdown and seeing our children, we started realizing that how we raise our children left a lot to be desired. Creating platforms for people to get help other than just physical contact, we then had to learn and do a new normal. Educate and minister to all about gender-based violence and mental health, which are the major challenges that we picked up that actually were affecting women. And then the church hall has to be transformed as well, because when the schools were closed and children could not access education, we realized that as a church, we would have played a role to open up our services to see and make sure that our children are able to access education, particularly those that are in the rural areas. Next slide, please. Thank you very much.
Well, thank you so much, Dr. Monde, for that presentation. And now I'd just like to remind us to put any questions that we may have in the chat box. And as we had mentioned earlier, our third speaker was not able to join us today. So I'd just like to first thank our presenters for such a clear and concise presentation, and possibly ask you, in terms of working with the based communities and working with the churches in light of this pandemic. How has it been accessing funding for the activities that you have talked us through? And where have you been able to access funding at such a time when the world has all been in an upheaval? I think whichever of you is able to start.
May I start, Ruth?
Mm-hmm. Yes, please.
Yeah, well, the funding has been one of the greatest issues, actually, or barriers to fighting effectively against COVID-19. Of course, you know, we are very appreciative and very grateful to our partners who were able to support us despite the fact that everyone, you know, is struggling with the same pandemic. So part of the funding we got it from our traditional partners, and also our donors actually were flexible enough, and they allowed us to use the resources we have to respond to COVID-19 in different ways. You know, especially educating people and raising. And what goes with that also, we've been creative and innovative in terms of responding to COVID-19, because some of the activities did not require a lot of money. And so we used in some, for some activities, we used the resources we had already, especially human resources. So that has been very, very helpful. But while that gap is still there, the funding part of the response to COVID-19.
Mm-hmm. Thank you. Would you like to speak to that, Dr. Monde?
Yes, Ruth, what we had done, as a church is that we actually rechanneled the existing funds from the mission groups. Mm-hmm. What we had done as a church is that we rechanneled the existing funds that were from our mission groups, because those are funds that we would have used to host some of our conferences. So the presiding bishop's intervention was that we then pulled all of those resources, and then they were channeled into a COVID relief fund to our synods and our circuits where there was the most need. And then those funds were then used to procure PPEs, food parcels for the various members. But it is a challenge, as Jean has indicated, that with the, because as a church mainly, we rely on the income that is coming from the congregants. So with the churches being closed, we found that some of the congregants were no longer coming, but we also had existing program through our mission unit. So they had existing funds. So then they channeled those existing funds to respond to the COVID-19 challenge.
Mm-hmm. Mm-hmm. Oh, thank you. Then there's a question here that's directed for Nyandwi. In the DRC, how have the different churches worked together? And are there areas where cooperation has been difficult?
Unity of denominations. So that's one of the basic things actually that we train church leaders on, to work together. So that was not really difficult for us, because that's what we are training them on, to work together to bring about community development. So, and also since we were still responding to Ebola, so we had already created that kind of bond or collaborative kind of way of doing things. So it was not really difficult for them to work together. The cooperation has been almost 100%. So there is no issue about that. The only issue, as I said, is limited funding. But otherwise, but with the limited funding, actually, they are doing a great job working together to reach out to their community members and church members.
Mm-hmm. Great. And I think to Monde, there are a couple of issues that are being raised in terms of women. And one question is, would you be able to share more on the role that women play in the health of their communities? And then second to that is, when it came to the campaigns on wellness for women's health, how have the men responded to this? Has it been a good response? Have there been any adverse experiences?
Oh, in our church, what we had done is that we had set up a women's wellness group, which is what I'm responsible. I'm part of, a member of. So because we already had existing structures, and even our church has got a health and wellness desk that is already in place, that is led by the mission unit. So what we have then done is that we had already gotten a buy-in from the congregation, and we already have an existing movement that is called Thursdays in Black, which is fighting against violence against women and children. So when we started then raising it sharply, it was not something that was new. And what we have done is, the question is asked, what is the best approach? Is that what we had then done is that we did not treat men as perpetrators when we approach these campaigns. We actually treat men as partners towards the solution. So our men's guild, young men's guild, which is part of our church structure, has also been the one that has been in the lead, meaning that as men, where gender-based violence is not going to happen in our time. So I would then recommend that whenever you are approaching any challenge, you actually then do it as a collective rather than one gender against the other gender, because when then you then treat the other gender as a perpetrator, they tend to be defensive. Whereas if you then work together as a partner, and our church actually has been very progressive, that we are one of the first churches to have a female presiding bishop that was appointed and elected. So our church has advanced in terms of women issues and gender challenges.
That's a good point, putting it as not as men against women, but all of us together towards the same goal of wellness. And Mr. Nyandwi, there's a lot of appreciation on the chat on your approach and the appreciation on emphasis on prevention. And one question is, can you give an example of where believers cared for the sick and thus showed the love of Christ? And this can reinforce the prevention messages and build faith and love.
Yeah, thank you. Well, I don't have a specific example for that because actually I haven't even heard about any case in the communities where we work. So there could be some cases for family members of some of the church leaders, but it has not been brought to our attention to know that. That's one. But number two, for COVID-19 sick people, because they are restricted when they're taken to specific hospitals. There are restrictions in terms of visiting, those who are sick. But what I know, probably outside our zones of intervention, as Christians, generally speaking, what I've seen, people have tried their best, even though it is very, very hard and there are so many restrictions, but people have really gone beyond those restrictions, of course, protecting themselves to care for those who are sick and for those who have lost their beloved ones. Because, as you know, in Africa in general and DRC in particular, people are very social. And so, by the way, this is another challenge, stopping from being social because of COVID-19. So people have been struggling, put aside, the Christian life, people are generally social. So this has been, observed, outside our areas of intervention, generally speaking, but in the area of Christian life, other brothers and sisters that we have seen around.
I think just listening to both presentations, it's quite clear that in this context that the church leaders are playing such a critical role in communities. And one question is that seems that when the church leaders play very important roles, but when it comes to interventions, they are relegated to the kids' table. And the question then is, how can this gap be bridged so that church leaders are given a place at the table to respond effectively and efficiently to the needs of their communities at such a time?
Ruth, I'm not sure if I've understood quite well the question.
Mm-hmm.
Would you mind repeating it?
Yeah, given that the church leaders are playing such a critical role in their communities, based on your presentation, but when it comes to such times as, say, the COVID pandemic, they are relegated to the kids' table, meaning they take kind of a back seat in many health programs. And the question is then, how can they be empowered to come to the table and respond effectively and efficiently to the needs of the communities?
Yeah, and I think that where the response can come from one of my recommendations, that church leaders need to be equipped with skills and finances. Well, that's one aspect of building their capacity, so that they are readily available to intervene whenever there is, whenever there are epidemics or a pandemic like COVID-19. How? Well, this could be available, in the case of world relief, because that's what at that level, so that they are, and even disaster risk reduction, so that they are ready to respond anytime that there are such issues of epidemics or a pandemic like COVID-19. By the way, we've started doing this in one of our church empowerment zones in Goma town, but that's just one area. Of course, we can extend that to other church empowerment zones if we have resources. So yeah, that's part of our approach, by the way, but that's a good question.
Mm-hmm. Great. Dr. Monde, would you have any thoughts on the same?
Yes, we actually learned lessons from how we addressed the HIV pandemic. Initially, it was treated as a biomedical challenge, but ultimately we realized that it's a socio-economic challenge. So the government actually then partnered with civil societies, and churches are part of the structures. So when we had then COVID-19, they tapped into existing structures. So our churches are represented in those multi-stakeholder civil society committees that meet with government. And I also saw a question that asked if there is a formal relationship between Gauteng province and the churches. Yes, there is an MEC that has actually been allocated to work with the faith-based communities. And during the COVID-19, they would then have spiritual outreach programs that were reaching out to the frontline workers within the province. So that is another relationship that we then looked at, that the church also needs to be proactive and not just sit and wait to be approached. Like we did with the webinars, we actually approached government and say, this is the response, this is the resources that we have as a church. How then can we partner with yourselves, and where do you see our role? So it then becomes a symbiotic, mutually beneficial relationship.
Mm-hmm. And just to draw our attention to the chat, that there's also some good answers coming in as we are speaking. And someone had asked about good curriculum that can be used. And there's one called Loving Your Neighbor During COVID by raiseupglobal.org. Thank you so much for those responses. And the chat is really active right now. I'd like to take you back to something that had been mentioned kind of in passing about conspiracy theories and the challenge that we have been having with that. Have you had any challenges with the church leaders misinforming their church members on COVID, especially on preventative measures and being against vaccination? I know we've had that in a couple of the countries. And how have you managed any such cases?
Yeah, well, I think I would say this is a common problem, not only for, well, it's not particular to the church, but it's a common problem, you know, to everyone. But you know, I haven't had any specific case where a church leader stands and misinforms the church members. But this is something that is going on. People are scared, but you know, when you talk about vaccine, you know, there are many questions raised about it by different people. So now in our situation, since you know the vaccine was launched last week, we expect that people will be educated on that. But really, this is something that is still kind of pending, that needs to be responded to. And I think a few weeks or months ago, some school children ran away from their schools because they had heard that people were coming to vaccinate them. So so this is a general issue, not only for the church. That's what I would say. And that is, you know, that goes to to what I said. There are so many theories, and there's so many things going on through the social media, and sometimes people are confused. They don't know what is really the truth, who tells the truth, and who owns the truth. So yeah.
Yeah, and what's your experience on the same, Dr. Monde? I think you have an intersection between being in the Ministry of Health and also being in the church. What do you say?
Yes, we have had controversies around vaccination. So what has happened is that our minister has actually been very proactive, that he's gone into public to engage the communities and given information. We've had webinars that have been televised where he would invite scientists to actually engage with the public, and then they would ask questions. So I think information is the key to actually allaying any of the fears and the conspiracy theories, and transparency. And that's, I think, what our department has also already been doing, and constantly informing the public whenever there are challenges or changes with regards to they don't wait for the communities to hear from the media, but they openly go and engage with the members of the public. And like I indicated, as members of the church, we're also being part of the civil society, then they are part of the engagements. And our responsibility also as the civil society is to go and share scientific information with the members of the communities.
Thank you. I'd just like to stick with you, Monde, for a bit. And there was a question about expanding on your approach when it comes to addressing the mental health and wellness for women. If you could just expand a little more on how you're going about it at this time.
3 years ago, our general president of the Women's Manyano set up a committee that she calls Wellness Committee. It's constituted by healthcare professionals that are specializing in mental health and general well-being. So you've got medical doctors, psychologists, social workers coming in from the different spheres. And then that committee then was set up, and then their responsibility was to ensure, as our church spans over 6 countries. So that is why we're then called a connection. So our responsibility was to make sure that in all of our synods, we have set up these committees, and then the synods then set up the committees at circuit level, and then the circuits then set up the communities at society level. So we then had a top-down approach and a bottom-up approach of ensuring that we then train and empower all our healthcare professionals that are within the churches to then assist and ensure that our community members that require mental health support through our ministers as well. Because yes, we have got ministers and ministers' wives, which are reverends in that committee, so that those that require a spiritual engagements or support are then supported, and then those that require the psychiatrists and social workers are able to be assisted.
Well, thank you so much for that. And just to keep looking at the chat, and I see Paul Hudson has shared another resource on COVID-19 and response from SIM. I'm hoping that we can be able to archive some of those as we talk. And I think there have been a lot of questions and we can go on, and unfortunately I'm looking at the time. And I just want to say to both speakers that you have really given us a very good picture, and we have learned a lot about the context and the work of the church. And I wonder then, do either of you have closing statements that you'd like us to be at the forefront of our minds as a take home from this discussion?
Yeah, probably. First of all, maybe let me respond to one question maybe that you did not see. It was sent to me directly, so but I think it's interesting that it was expected that COVID-19 cases would be many in DRC, but contrary to what was expected, there are fewer cases. Why is that so? That's the question. Well, it's a combination of factors. There's no one specific answer, but one of them is that, most of the people live in rural areas. And as we have seen, most of the cases have been identified in big cities, like Kinshasa, Goma, and others. While in the rural areas, there are very few cases. And number two, it's a young population, and so it's not like where you have elderly people and things like that. But also the government took preventive measures early enough, when it was announced, as opposed to to many countries which took preventive measures a bit late. So those are some of the. But also people have the experience from the Ebola epidemic in DRC. So health authorities have developed this experience of fighting, epidemics, and people are careful. And organizations like World Relief, we intervened early enough to sensitize people, educate people, and through training and messaging, through community radio stations and things like that. So there's a combination of things that really helped prevent this from spreading further. And now the government has also taken very strong measures. Upon arrival at the airport, you have to be tested, even though you may have a negative test certificate that you are COVID negative and things like that. So preventive measures have helped quite a lot. Now, maybe some takeaway from me or from World Relief is that yes, the church institution is a very strong one, because it's the only institution that stays with the community members. It doesn't. Whatever happens, whether there is war, whether there is epidemic or pandemic, the church is still there to minister to people and to help people. So it would be good to think about how to invest more in building the capacity of the church leaders, so that they may be well equipped to respond to epidemics and pandemics, whenever they come up.
Yeah, well, all right. Thank you. Dr. Monde, parting shots for us.
Thanks. My personal mantra is be the change that you want to see in the world. And I think that's one of the reasons that made me then move just beyond being a clinician and actually then become a community activist. And I then do believe that as each and every one of us that are part of this webinar, there is a change that we can actually make in our communities. And I've also been part of the World Council of Churches Health Promoting Churches handbook. So I think it should be released very shortly. That handbook actually then gives a guidance to the churches on how to develop health promotion within your various church. And it also varies from a wide range of topics: mental health, your HIV, all these communicable and non-communicable diseases that are affecting our communities, because we believe that churches can actually play a greater role in supporting the government in implementing some of the programs. So there is a lot that we can do. And as John has said, that churches are not just a place of worship, but churches are a place of healing and transformation. And together each and every one of us can actually play our individual role in ensuring that we make sure that our community becomes a healed community. Thank you very much.
Oh, thank you so much for those insightful comments. And thank you for the activity in the chat. May I see that you have also dropped another link from WHO, which is available in both French and English, that can be a resource for us. And I would just like to thank the presenters so much, and also for all of you who have joined. We really hope that you have enjoyed the session and that you have taken away something that can be of benefit to you. And we would really like to hear your thoughts on what you thought of this webinar. And I see that Kathy Ab has put in a link for a small feedback survey, and would be really appreciative if you would fill that in. And also just to highlight that this webinar is part of a series, and this was the first day, and tomorrow we invite you to join us again on another webinar that is on helping the church navigate COVID-19 lessons from 2021. It will begin tomorrow at 8 a.m. EST, and it will focus on the results of a recent landscape analysis on vaccine hesitancy in the faith-based communities. You would not want to miss it, because I'm sure it will cover some of the questions that we may have had today and will be a great follow-up. I would also just like to send out a reminder that CCIH has the annual conference this year, and our theme will be cultivating unity in global health. We begin on May the 11th, and we'll be glad if you would join us. If you go to the website, I'm sure you'll be able to get more information on how to register. Thank you so much for your time, and I see that we are running out. We have 1 more minute, so if you would allow, please allow me to close in prayer. Almighty God, we thank you for the work that you have placed into our hands. We thank you for our speakers and the wisdom that they have brought to us and the learning that they have brought to us from their work. We thank you for the work of each and every individual on this call, and we pray that you may continue to give us your wisdom, your leading, and your grace as we work towards giving and bringing a healing hand to the communities that we serve around the world. We pray all this through Christ our Lord. Amen. Thank you very much for joining us, and we wish you a blessed rest of your day wherever you are joining us from. Thank you, Dr. Monde. Thank you, Mr. Nyandwi.